Hello and good afternoon. Welcome to Wednesday Wellness, a free live educational series by Trinity Health. We are thrilled to have you join us as we discuss pelvic floor therapy. Before we get started, we do have a few notes to share. Your cameras and microphones have been turned off to ensure a smooth experience. If you have questions during the presentation, please use the Q&A chat feature located at the bottom of your screen. We will be addressing questions at the end of the presentation. Lastly, today's webinar is being recorded, and we will share a link to that recording via email over the next several days. Without further ado, I am pleased to introduce Jill Howell, a pelvic floor physical therapist with Trinity Health.
Hi, my name is Jill, and I am a physical therapist at Trinity Health Muskegon. And I have been a PT for about 20 years, and I have been specializing in pelvic floor therapy for about 18 years. So that's a little bit about me. So let's get into pelvic floor therapy 101. So what is pelvic floor therapy? So it can encompass a lot of different things, as in treatment for bladder dysfunctions, such as urgency or frequency. That means that you have to go constantly, or if you have an urge, you have to make it to the toilet. We also treat retention or incomplete emptying, prolapse symptoms or prolapses itself, and enuresis or bedwetting. We do see children as well at our clinics here in Muskegon. We also have treat for bowel dysfunction or constipation, because constipation can lead to leaky bladders as well, and also bowel leakage. We also treat pelvic pain or vaginismus, or pain with intercourse, or vulvodynia, which is pain around the vulva area, or bladder pain such as interstitial cystitis, where your bladder actually spasms and causes pain. We see people post and pre-pregnancy. We treat diastasis recti, where it's the separation of your abdomen after birth or just in general, and scarring from pregnancy, whether it be vaginal or C-section scarring. So what is your pelvic floor? The pelvic floor makes up 1/3 of the pelvic pyramid. So if you look at this picture right here, there are three spots. Your pelvic floor is the blue at the bottom, it's your base, and then you have your transverse abdominals or your TVA, and that's the front, and then the back is your multifidi, or in between your spinous processes in the back. And all three of those components have to be working correctly together in order for you not to have any sort of pain or dysfunction in any of those areas. So if you have back pain, it could be coming from your pelvic floor, or if you have pelvic floor dysfunction, it could be coming from your back or your abs. So we look at all three of those components. So all three of those units working together not only help support and stabilize the lower spine and pelvis, but they help support your organs and helping them perform properly. So we think of it as your floor and your core. So this is a picture of your pelvic floor that is looking down from your head towards your feet. And as you can see, there are a bunch of little muscles in there, and there is nothing bone structure under those muscles. So if you think about it, all your organs, most of your body is sitting on top of that pelvic floor. And if that's not strong enough, it can cause dysfunction, and it can cause you to leak, it can cause prolapse, it can cause pain, all those things. And we don't normally think about those little muscles down there because no one ever told us before that we should be working on them and using them. So what is normal bladder health? The average bladder can hold 2 cups of urine before it needs to be emptied. A normal range of voiding urine is 6 to 8 times in a 24-hour period. As we age, our bladder capacity can get smaller, but voiding should never exceed once every 2 hours. So if you're going every hour or every half hour, you have a bladder dysfunction. Your urine stream should flow easily, and you shouldn't have to push to get the urine out. An urge is a signal you feel as your bladder stretches. Urges are not commands to go to the bathroom, but rather a signal that says, hey, maybe we should think about going in a while, or can we wait? But they are not something that if you have that urge that you run and go to the bathroom. So facts, there's no waiting to go to the bathroom unless it's less than 2 hours. There's no just in case peeing. So all of those times that we tell our kids when they're younger, hey, why don't you just go to the bathroom before we go? You're training your bladder to go when it doesn't really have to go. So every time, like, okay, we're going to go on a long car trip, you better go right before. Even if you went an hour before, is probably not the best idea. We need to be able to sit all the way on the toilet when we go to the bathroom. No half sitting, no hovering, because that puts extra stress and discomfort on your pelvic floor and can cause other issues. And we always want to think about wiping front to back, because if you wipe back to front, you can get the bacteria and cause a UTI or other issues. So we also have to think about bladder irritants, or things that can make the bladder spasm into thinking that you have to go to the bathroom sooner than your 2 hours, or cause pelvic pain or discomfort. And they also can cause leaking as well. And those irritants are everyone's favorite food. So caffeine, citrus fruit, especially grapefruit, pineapple, oranges, spicy foods, tomato-based products, so spaghetti, pizza, all of that fun stuff, some milk products, and artificial sweeteners. So what is your bladder's best friend? Water. And water is essential in your body. It makes up 50 to 60% of your body anyway. So we should be drinking enough water to help retain that. The water helps flush our irritants out of the body. Concentrated urine can irritate the lining of the bladder and can cause urgency or spasm in the bladder to make you feel like you have to go more often than you actually do. So it is recommended that water you drink about half your body weight in ounces, but it can vary for some people. But usually you need to drink about half your body weight in ounces, whether it's about 70 to 80 or a little bit more of water a day. So get your Stanleys out, fill them up with water, and sip on it throughout the day. Don't go chug all your water at once, because you're going to have to go to the bathroom more often. So those are the benefits of water. So when you come to see us, we give you a bladder health quiz. And these are things that are, if you're thinking, do I really need to go to therapy? Some of these can help you answer that. So we like to rate the following statement. My bladder is controlling my life from not at all to completely. Is your bladder telling you that you have to know where all the bathrooms are around town? Is that how you plan your day? Do you be like, oh, I can't do this because I'm going to have a toilet near me? Those are things, and you should be going to a pelvic floor specialist for those. Do you urinate more than every 2 hours in the daytime? Do you urinate more than once after going to bed? Typically, 1 to 2 times is normal. Anything more than that is not normal. Do you have trouble making it to the toilet on time when you have the urge to go? Do you strain to pass urine, or do you push, or what they call the power pee, to go to the bathroom? Do you lack the feeling that you need to go to the bathroom? Do you feel like you can hold it for hours on end? That is not good as well. Do you empty your bladder frequently before you experience the urge to pass urine? So if you're going too often and don't have those commands, that can cause issues as well. Do you have the feeling your bladder is full after urinating? Like you get up and you're like, oh, I could go again. That might be because you go too often, that even just a little bit of urine in your bladder can make you feel like you have to go again. Do you experience a slow or hesitant urine stream? When you go, does it take you forever to go to the bathroom? Does it splay not in a nice strong stream, but kind of all over the place? That can mean you have a tight pelvic floor. Do you have triggers that make you feel like you can't wait to go to the bathroom? Like running water, like you're at the sink and you turn the water on and you're like, oh, I got to go to the bathroom. Or doing the dishes, or pulling into the driveway and opening the door into the house. Those are all things that we can control and get you past where those things don't happen anymore. Are you unable to stop the flow of urine when on the toilet? Do you have an urge to go, but when you get to the toilet, very little comes out? You may have gone too soon, or you might have a tight pelvic floor. So, what else do we treat? Pelvic pain. So what causes pelvic pain? Interstitial cystitis or bladder pain caused by spasms, dyspareunia or painful intercourse, muscle spasms, either in your back, your pelvic floor, your bladder, your legs, your hips. Labral tears in your hip can cause pelvic dysfunction as well and increase spasms in your pelvic floor. Postpartum, definitely because of the trauma of having a child. Endometriosis and scar tissue. Also, constipation can have an effect on your bladder as well, and also your pelvic floor. So constipation occurs when the colon absorbs too much water. So say you drink some water and all it does is absorb it, and then it increases and it doesn't let it go pass through. So your colon's muscle contraction is slow or sluggish, delaying the transit time. So it's not moving appropriately through your bowels. Constipation constitutes as no bowel movements for 3 to 7 days. So what is normal? What is normal? Going to the bathroom. Having a bowel movement every day or every other day is normal. What causes constipation? Well, lack of hydration, and we've already heard that water is very important in our life, and hydration can also affect your bladder. It also can affect your bowels. So the idea is to drink your water. Lack of exercise or movement can cause constipation as well. That's why after you have surgery or you're in the hospital for a while, they're like, you need to get up, walk around, because that helps promote you having a bowel movement. And also lack of fiber in your diet. If you were to really track how much fiber that you have in your diet, you would be surprised how much you probably don't eat in a day. And you should be having about 20 some grams of fiber per day in your diet. So constipation, the bowel movement fewer than 3 times a week, having hard stool or difficulty passing, you're straining a lot to have a bowel movement, and it feels like you're not done, but nothing else will come out. So this is a scale that we use in the clinic to find out exactly, how your bowel movements are typically during the day. And if you were to tell me that you are a type 3, 2, or 1, I would consider you constipated. And anything 5, 6, or 7, I would consider it diarrhea. A type 4 is a normal bowel movement, and it should be easy to come out, no straining, no difficulty, and nice like a sausage. So, toileting habits. We want to establish a bowel routine. So it can take a week or more for a change to happen. Typically, you want to try to have that bowel movement the same time every day. You also want to try to eat your meals the same time every day, because if you start switching that up, that can affect your bowel movements as well. We want to use exercise, diet, colon massage to help stimulate a bowel movement as well. And we do not want to delay the urge of any kind for a bowel movement that can screw up your pelvic floor. You know how sometimes we say we can delay it for urinary stuff, we cannot delay it for a bowel. You can allow 10 minutes when you're on the toilet for a bowel movement. And if you're unproductive, get up and get off the toilet and try again at another time. We do not want to sit on the toilet longer than that, because that pelvic floor is unsupported in that bowl, and it can cause a lot of strain and pressure on your pelvic floor. So what are proper bathroom mechanics? So sitting all the way on the toilet and relaxing, sitting with your feet, not your knees, on a stool. You want to be able to wobble before you stand up. That's especially for your bladder, because your bladder is a fluid-filled sac. And if you just sit in one position and then go to stand up and you leak sometimes, it might be because you haven't emptied your bladder all the way. We do not want to push to urinate or have a bowel movement. And we want to try to have that bowel movement every day to every other day. So, what is the best way to go to the bathroom? Having your feet up on a step stool, like the squatty potty. Do you have to go get a squatty potty? No, you can just go get a little step stool at the store, or I've had patients use a garbage can on its side to put their feet up on. And what it does is help the anal rectal angle to allow easier defecation, so you don't have to strain. So if you look at the first picture without the people with their feet up, that angle is kinked. And when we put our feet up on the stool, the angle is not kinked, so it's easier for you to pass the bowel movement. We are meant to go to the bathroom in the squatted position. And as a Western civilization, we have found that, oh, well, if we sit down, it feels better and it doesn't give us all these aches and pains in our knees. We're living longer than we used to, all of those things. Now, with the raised toilet seats that everyone's getting now, it's really important for you to get a step stool to get your feet up to help that angle so you don't strain or push to have a bowel movement. So, what to expect during evaluation for pelvic floor. So when you come in to see us, we want to understand what exactly is going on with you. And we will ask a lot of questions, and what your triggers are, what causes your pain, how often you go to the bathroom, do you have pain with intercourse, how many kids have you had, how many surgeries have you had in your abdomen or your back, because all of those things can trigger or help us paint the big picture of what exactly we're looking at. So we'll look at that past medical history. Like I said, I'm going to want to know your diet you're voiding during the day. How many pads are you doing? Do you leak with running, jumping, coughing, laughing, sneezing? What have you tried in the past? I will also do a low back and a core check, because that low back, like we talked about in the first slide, it is super important with your pelvic floor, as well as your core and your hip actually as well too. So we'll look at all of that, the 360 approach, and then we will also look at the internal. So if you're comfortable on that first day, we'll do an internal palpation of the musculature, see if you're tight or if you're weak, if you can do a Kegel, if you can't do a Kegel, if you're using other muscles to do a Kegel, and we'll check to see if you have a prolapse as well. Then we'll go through some education on what we find, and we'll talk about those things, and we'll talk about different treatment options that we can do at the clinic as well. And then we'll give you a home program so you can start doing those things when you get home. A lot of it is education for your pelvic floor. So, what are our possible treatment options that we do? Well, we look at the core, the back, and the hips. So you probably will get some exercises for the core, back, and hips as well. We will strengthen the pelvic floor as well as those core, back, and hips with biofeedback or Kegel exercises. So your pelvic floor is an interesting animal. We don't know that it's working like we can other muscles in the clinic, like your knee. Like you can see your knee working when you come to therapy. You can watch us strengthen your knee, and it's really hard to see if those muscles are kicking in for your pelvic floor. So we like to use what's called a biofeedback system at our clinic. And what that is a little probe that we insert in vaginally, and it hooks up to our computer. And that helps you be able to see if you're contracting the correct muscles or not by using a graph. So when the graph goes up, you contracted your pelvic floor, and when it comes down, you rest. So it could show us a lot of different things. It can tell us, do you have a lot of muscle spasm down there? Should we be doing Kegel strengthening even if you're leaking? Because sometimes that is not the option. We might need to be able to have to relax your pelvic floor before we can strengthen it. So we kind of look at that. We can also strengthen with what's called stimulation with that same machine, with that probe. It can give you a little bit of electrical impulse to kind of get those muscles to be working again as well. Kind of like if you had an ACL repair or a total knee replacement, sometimes they'll put the little electrodes on your knee to help give those muscles some sensation to start working again. We also do internal trigger point release, and we use dilators as well to help stretch that area out so the spasms aren't controlling your life or making you feel like you have to go to the bathroom all the time, or decreasing your pain or decreasing scarring, all of that stuff. We also use internal stim for that as well to decrease spasms. We work a lot on breathing and relaxation techniques because our diaphragm is a very important tool for the pelvic floor as well. If you are not breathing correctly, more than likely your pelvic floor is not working correctly. We do some cupping on the abdomen, especially with those C-section scars. We do a lot of muscle energy to make sure your alignment is right, because if your hips are off or your back is out, your sacrum's rotated, those all play effect of your pelvic floor. For bowel dysfunction, we do use some balloon retraining, and that can help us figure out, like, are you pushing or pulling when trying to have a bowel movement? We can strengthen that with having the bowel movement, and it's just like an anal mammography test. We give lots of education on bowel and bladder, and manual manipulation of the abdomen as well to get things moving appropriately for bowel dysfunction and urinary stuff. So, what are some of our techniques that we do or we talk about? So this is some of our little tidbits that we like to give. So the hydration celebration, or staying hydrated is the key to a healthy bladder. So limiting fluids with the intention to decrease trips to the bathroom can actually fire back on you, leading to a more concentrated urine, and it irritates it. And then you feel like you have to go even more. So water helps dilute the urine, making it less concentrated and therefore less irritating. Plus, it helps flush out all the bad stuff. So keeping your urinary tract clean and fresh. So we want to really promote that H2O. Constipation. Are you constipated? Did you know frequent constipation can create bladder urge because a full rectum can push on the bladder, decreasing the bladder's filling capacity and increasing your urge. So just like if you decided that you need to go to the bathroom all the time, and then so if it only fills up to half a cup in your bladder, and then you go to the bathroom at that half a cup all the time, that's when your bladder thinks it's filled. So when you have constipation and it pushes on the bladder, it can only fill to that half a cup, also causing urgency on the bladder as well. So bladder, dietary irritants. Some foods or drinks are not your bladder's besties. These include the spicy foods, your caffeine, your alcohol, your bubbly water. So mix in water in between those foods and drinks to make it less offensive to the bladder in time. Your intake mindfully around times that you would rather not be going to the bathroom. So say I have to have my cup of coffee in the morning, and I know coffee really irritates my bladder. I will drink a full glass of water with it, and just know that the next couple hours, I might need to be closer to the bathroom, but I am not giving up my coffee. So some pelvic floor exercises. Your urge can be related to a weak or a tight pelvic floor. So we practice coordinating pelvic floor strength, plus focusing on the hip external rotation and abduction exercises as well. So with that being said, between a weak and a tight pelvic floor, if you have a weak pelvic floor, we focus on Kegels, and we focus on when you do a Kegel, you should be able to pull up and in without using your abdominals, your legs, or your butt muscles. If you have too tight of a pelvic floor, we need to work on relaxation. And unfortunately, a too tight of a pelvic floor and a too weak of a pelvic floor can cause the same symptoms. And we won't know which one you are until you actually come in and have an examination. So bladder bus training, you can be in control of your bladder. So working on increase your holding time for short durations, such as 5 minutes, and progressively increasing the time longer to teach your bladder and your nervous system to tolerate the increased stretch. So say I'm going to the bathroom every half hour. I'm going to try to fold it off for every 35 minutes. And then when I get really good at doing that, then I'm going to move it to 40 until I can hit that 2-hour mark. And you will be having to do a lot of like breathing techniques to kind of relax your body, and techniques to get your mind off of your bladder as well, because that's what helps you put yourself in that cycle and you're just going to want to keep going. But we can retrain the bladder by doing those types of exercises and work on diaphragmatic breathing and just kind of not thinking about the actual bladder and retraining onto a different topic. So, when to look for a pelvic floor specialist or therapist? Are you leaking? Do you have pain? Are you pre or postnatal? Do you have incomplete emptying? Or do you have constipation? Those are all times for you to find an appointment with one of us. So how do you get an appointment? You can contact your PCP, your OBGYN, your urogyn, or your gastrologist. Any one of those can refer to us. And in Muskegon, you can call the Lakes Rehab at 231-672-7960 or our central scheduling option, and hit option 2 when you call our general number as well. We also have been having pelvic floor classes in Muskegon once a month, where you will be with one of our specialized pelvic floor therapists in a group of 20 or less, and you will go over actual exercises, movements, and talk a lot about education of the bowel and bladder more in depth than what we did right here today. And those are cash-based classes for $20, but it helps you get in, it helps you try to see some techniques before you actually see your pelvic floor therapist, or it can even help you not go see them, because we are very hard to get into at this point right now because everyone wants to see a pelvic floor therapist. So if you can get into a class like that, that can help as well before you actually see us and try a couple techniques. So, questions?
Thank you so much, Jill. As she mentioned, we are moving into the question portion. So if you have not had a chance to, please use that Q&A chat feature located down at the bottom of your screen, kind of in that tool belt. And you can drop your question in there. We have received a couple already. So if it's okay, I would love to get started with those and see where we go.
Okay.
All right, the first one is, I have heard not to do Kegels for prolapse, for organ prolapse. Is this true?
It depends. So like I've said before about a too tight of a pelvic floor or too weak of a pelvic floor, if you have too tight of a pelvic floor or you're spasming because the prolapse is coming down, it could actually push things out or not work the way that we want to. We get a lot of people that come for prolapses recently that need to have surgery, and the doctor wants us to calm down those muscles before they will do surgery. So you're So your recovery is better. You won't have pain as much afterwards. So sometimes we do where we do some manual first and then do some strengthening. And sometimes we just do strengthening. But Kegels, it's not, you should be able to do Kegels with the prolapse. I guess that's what I'm saying. But there are times where you don't have to.
Thank you. The next question is, do you have any recommendations on how to reduce inner abdominal pressure when you're laughing or coughing?
So when you're doing those things, we always think about diaphragmatic breathing or belly breathing. And if you can like blow out fast after doing those things, that can help decrease some of that abdominal pressure. But it's really hard when you're like laughing or coughing for like an extended period of time to try to get that abdominal pressure to decrease. But there are ways that we work on diaphragmatic breathing with that.
Thank you. Next question is, if you had to pick one exercise for someone suffering from bladder prolapse, what would it be?
That's a hard one because you'd want to start with, if it was appropriate, you'd want to start with Kegels. I would do, though, any core or hip exercises. Clamshells are really good ones to do, bridges, because those can help get the hips up a little bit. I don't think there's any just one exercise. I mean, I would avoid deep squatting for a while or heavy lifting, but I don't think there's one exercise that I would just solely do.
Thank you. This next question is asking if you could just go back and review that part about the classes.
Yes. So the classes that we have are in Muskegon, and it is in a conference room setup, kind of with a slideshow that I have right now, but it's not the same slideshow. It goes a little bit more in depth on things. We talk about your bladder, we talk about your bowels, we talk about dietary stuff, we talk about breathing. We go over some of the exercises that are okay to try to start, but we also say that if any of these exercises that we teach you at the class increase any of your symptoms, don't do it and wait till you see your pelvic floor specialist. But they are $20 a class. We do have a QR code that you can scan. We have 2 classes coming up. We have one next Monday, the 22nd. And then I believe we have one Monday, October 13th. They're at 5 p.m. And I am sure that we could send out a QR code to the people in the class if they're interested.
Yes, we would be happy to include that resource in the follow-up email. All right, our next question is, how long can I expect my first appointment to last?
So we schedule the appointments at our clinic for about 75 minutes. You can expect to be here for about an hour. We use all of that time to, we have an extensive interview process, kind of like, what are you doing? How are you, like, what are your symptoms? We talk through all of that stuff with you. We do that evaluation of your back, your hips, your core. If you're okay, we do the internal, and that kind of stuff takes time with the dressing and the undressing. We go over the exercises, we make the appointment. So I would expect to be around an hour. Maybe depending on your case, it could be a little bit more, it could be a little bit less, but typically an hour.
Thank you. Next one, for us postpartum folks, would you say it is more likely that urinary leakage comes from the pelvic floor being too weak or too tight?
It's about 50-50, honestly. Depending on the birth and what exactly happened. Did you tear? Did you have it vaginally? Did you have it C-section wise? It's about 50-50. We probably do a little bit of everything with those patients.
Thank you. Our next one is, Is pelvic floor therapy covered by insurance, or is it mostly an out-of-pocket expense?
I would say 90% is covered by insurance. We have found ways where we can code it certain ways so it can get covered and use certain treatments that are covered as well. I haven't had anyone that has come in and said that they haven't been covered by therapy through their insurance.
All right, our next question is, does stress or anxiety have anything to do with urgency and incontinence?
100%, yes, it does. So your stress or anxiety can, so I like to tell people, if you're stressed, and we all like to carry our stress like in our jaw and in our neck, and when you're tight and spasmy up there, it directly correlates to our pelvic floor. So sometimes the people that have like a lot of jaw pain or they grind a lot, I ask, are you supposed to have a bite splint? And if they say yes, I go, you need to wear it at night, because what's happening is it's causing your pelvic floor to become tight as well. Because when we clench here, we automatically clench down there. So yes, stress and anxiety can definitely play a part in our pelvic floor.
Thank you. All right, next one is, to clarify, a urogynecologist is different than a pelvic floor specialist, correct?
Yes.
Thank you. Is it more likely that as we age, the pelvic floor weakens?
It's about 50-50. I mean, it depends on how you grew up and what you were doing and because we all go into our normal, like, hey, we thought this was normal. Like, I thought I was only supposed to have a bowel movement twice a week, or I thought going to the bathroom every half hour was normal. So honestly, it all depends over time. It could be that you have a tight pelvic floor. It could be that you have a weak pelvic floor. But I mean, it could be both. But yes, as we age, we do get weaker overall. But does that necessarily coincide with your pelvic floor? Not all the time.
Thank you. For someone with diastasis, is there a space that would not be fixable with pelvic floor therapy?
I mean, for like anyone, like if you're like a really bad diastasis, because they rate them on different scales, it's just like a prolapse. I will tell people, I'm not going to fix your prolapse if it's coming out or it's like right there. I can fix your symptoms. I might not necessarily fix the prolapse. Same thing with diastasis. I might not be able to get it all closed all the way, especially if it's a very big one. I might be able to get it a little bit better and you strong enough that you don't have the symptoms that you're experiencing, but I don't ever tell anyone that it's going to go back to 100% normal, because probably not.
Thank you. The next one is, do you have a resource or a link that could show how to do Kegel exercises properly?
I think we could probably send that out in our packet for the after class stuff.
If you have one that you would recommend, we would be happy to include that in the email.
Okay. Yep.
And that was another question that came up, is, would a recording of this be shared? And yes, it will. All right, I'm just double checking that we've gotten through all the questions that have been submitted. And that does look like it was our last question. So thank you so much to everyone who has joined us today. We'll take another minute just in case anybody has a last minute question that they would like to get submitted in there. But that was a wonderful presentation, Jill. Thank you so much. We really appreciate it.
Yeah, thank you for having me.
Yes, and we will include all of those resources that Jill mentioned, including that link to the Kegel exercises, the recording to today's presentation, and information on how to sign up for those classes that Jill discussed. So that was everything. Thank you again to everybody who joined us this afternoon, and thank you again to Jill. Have a great day.
Thanks. Bye.